Carmela Coyle. I serve as the president and CEO of the California Hospital Association. I am not often here, which is why I don't know how to use the button, and that's how important this issue is to us today. As it's a budget hearing, I do want to commend the work of the California Department of Public Health. They have been just terrific, and we are by no means anywhere through the major activities here. Now more than ever, they need the resources that they need, and Dr. Sonia Angel has just been fantastic, so a great partner at a very difficult time. The COVID virus, of course, is serious. It's a pandemic, and it is creating challenges throughout the healthcare system, with hospitals very much at the pointy end of that spear. Nurses, doctors, hospitals, deeply, deeply engaged in this. It's difficult to describe the level of ongoing conversation, communication, and minute by minute, hour by hour, day-to-day challenges. Two things that I believe we really need now. The first are some important decisions to be made by the state, and we need those decisions made right away. And second, we need to change the pace of change. We've got to work even more quickly. Everyone is flat out, but there is a sense of urgency that if we don't act more quickly, this will overwhelm the healthcare system very quickly. We've got one goal, and that is keeping patients and workers safe. Two important changes that have happened most recently. The first, of course, is in California, the virus can now be acquired within the community. That is a game changer for how we address it, because we now need to move very quickly, and here's the challenge, very clearly, from a containment strategy, really trying to stop the spread of the virus, to a mitigation strategy, and that is to limit the impact of the virus. And we are challenged because we have federal guidance, state guidance, and local guidance. And we've got international guidance on top of that. Four important decisions that need to be made now. First of all, we need to move from airborne to droplet precautions. I can't underscore how important that is. We've got to follow the science. We've got to follow the facts. The Centers for Disease Control, not as clear as they need to be in their guidance. We should, I believe, follow Washington State in their move to adopt World Health Organization guidance on this matter. It will allow us to allocate personal protective equipment where it needs to be, and that is with workers who are at greatest risk. And without it, we will unnecessarily overutilize and stretch our limited personal protective equipment. Second, we need to allow healthcare workers who have been exposed to the COVID virus or a COVID-positive patient who are not sick to continue to work. This is critically important. One organization, as you know, has had to furlough 124 workers for one patient. Good news is they're all back and healthy. We have furloughing between 80 and 100 workers per patient. We've got to change that, or we will not have the healthcare workers we need, not only to treat the COVID virus, but everything else that Californians need in the hospital. That is something we need clarity on immediately. Third, we need to shift, we believe, to a statewide rather than a county-by-county strategy. The counties have been doing a great job, but they are different. We have hospital organizations that span multiple counties with different sets of rule. We believe it's time to unify those. And finally, time to tap into the strategic national stockpile. We are on the edge of availability of what we need. And while most people are focused right now on masks, and that is very real, the face shields, we are really, really at the edge. And asking organizations and our healthcare workers and their safety to live on the edge is not where we want to be right now. So if that's the important changes, we do believe we can and should work more quickly, or as I mentioned, we will overwhelm the system. So we thank you for this opportunity and happy to enter into conversation in a few minutes. Thank you.